All right, welcome everyone. Thank you so much for coming. I'm Sarah Hannafin. I'm the new director here. Can you everybody hear me okay? Okay, sounds good. All right, so tonight we have Sue Flanagan here from Blue Cross Blue Shield, and we also have Medfield TV here tonight to record. Is everyone okay with that? Okay. Feel free to ask questions, and Sue will talk to you more.
Thank you, Sarah. Hi, everybody. Thank you so much for coming out tonight. As Sarah said, my name is Sue Flanagan. I am from Blue Cross and Blue Shield of Massachusetts. The presentation that we'll go through tonight, though, is really not going through any Blue Cross product information. What this is that as people approach Medicare, you're typically inundated with a lot of materials coming in the mail, whether it's from Blue Cross or a different carrier. As soon as you approach age 65, somebody's telling you that you have to take Medicare, and that may or may not be true depending on your situation. So what this presentation tries to do is really explain what Medicare is, when and how to enroll into it. Once you go on to Medicare, what are the types of plans that you can add on to Medicare? That way, when you are looking at that product information, you really are looking at it from an educated lens of saying, okay, this is the way this plan works, this is the way that plan works, and you can concentrate on the programs that will work best for you. So the presentation is broken down into two parts. The first part is all about the Medicare and the Medicare type products, and that should take about 45 minutes to go through. And I do take questions throughout the presentation. What I like to do is go through one topic at a time, stop after that topic, see if you have any questions, just because the information really builds off of one another. And then after that section, we'll talk about what are your options if you're retiring before Medicare eligibility. So maybe you're 65 and your spouse is 63. What are their options at that time? And that only takes a few minutes to go through. There's not a lot of options. Typically, that's a very expensive time frame for a lot of people. So, but the good news is the Medicare section, usually once you go on to Medicare, everybody's very happy with the plans that they choose. The downside is that you have a lot of choices, which is good, but you have to sort through all that information in that material. So we're going to start with Medicare alone, because what we find is once you understand Medicare, everything else makes a lot more sense. So we'll go through Medicare, but this slide right here is a kind of the lay of the land, also what we're going to be talking about tonight. So it's showing you that your starting point is always Medicare. Medicare, very oversimplification, is an 80-20 plan with some deductibles. Any doctor, any hospital that takes Medicare. You could stop right there, but if you need or want more coverage than Medicare, then you're going to be looking to a private insurance company like Blue Cross or whoever for that additional coverage. I'd say the first thing that you always want to ask, though, is if you've been working at a company for 10, 20, 30 years, you worked for a city, the state, you want to find out when you leave that employer coverage, do you have retiree health insurance coverage? And if you do, you're usually choosing from what that company is offering you because you paid in, you worked, that's a benefit for you. They're going to be paying some money towards that premium. And typically, if you don't take a group retiree offering, you can't get it back if you later on want to take it. So most people would start there. But that's just some lucky few that have that retiree coverage. For most everybody else, you're on your own. It might be the first time that you're leaving employer coverage and you're navigating this whole system on your own. So then there's these two pathways that you would be going down. Again, we're going to take each one of these boxes one at a time. But one pathway that you can go down are called Medicare supplement plans. And those are plans that pick up where Medicare left off. So they're going to pick up the 20% that Medicare left behind. They don't add in a lot of extras that Medicare doesn't cover. They're not adding in money towards your glasses, dental cleanings. And you can see there's a second box down there for prescription drug coverage. So you'd have to buy a separate prescription drug plan. This pathway is the most expensive monthly premium pathway to go down, but the least amount of money out of your pocket when you see those doctors or those hospitals. So one way of doing things. And then the other pathway, you never do both. That's why there's an or in the middle of the page, are Medicare Advantage plans. So a Medicare Advantage plan, these are the plans that you're seeing on TV all the time. The Medicare HMOs, PPOs, advertise zero premium, money towards your glasses, dental cleanings. So that is another way to do things. Medical, prescriptions, extras, all in one. Typically a lower premium, and they can range anywhere from $0 to a couple $100, but typically the most popular is $0 to about $100 a month. So all in one, but you pay some co-payments and costs along the way. So neither way is better than the other. It's just a weights and balance, and that's what we're going to go through here today. And we're going to refer back to this slide multiple times. But we're going to start with Medicare. Because again, once you understand Medicare, everything else makes a lot more sense. So Medicare is health insurance provided by the federal government. It's broken down into two parts. We have Medicare Part A and Medicare Part B. Part A is your hospitalization and your skilled nursing. And when you think about a hospitalization, what you want to think about is it's your room and board, the lab, the equipment, and everything you're doing in that hospital minus your doctor care. So doctor care falls under Part B, whether you're in or out of the hospital. And then Part B is all of your outpatient services, your labs, x-rays, MRIs. Part A is premium free. Part B is $164.90 per person per month. So once you go on to Medicare, everything's individualized. There's no more family or couple plans. If you're collecting Social Security, that $164.90 will come automatically out of your Social Security check. If you're not collecting Social Security, you still can go on to Medicare. Maybe you're going to collect at 70 and go on to Medicare at 65. It's up to you how you do that, but you would work it out with Social Security to pay that $164.90. How does Medicare work? Any doctor, any hospital that takes Medicare, no referral. So lots of freedom of choice. Most doctors take Medicare. Again, oversimplification is it's an 80-20 plan with some deductibles, and we'll see that on some upcoming slides. But before we go through that, we're going to talk about when and how to enroll into Medicare. Because as I said at the start, that's really where a lot of these questions come in. So most people can find themselves in one of the next three scenarios that I'll go through. So the first one would be if you're turning 65 and you're already collecting Social Security, then your Medicare card should come automatically to you about 2 to 3 months prior to your 65th birthday. And it always starts the first day of the month of your 65th birthday. So let's say you were born May 20th, you're not yet 65, but Medicare would start May 1st. You would have seen that card come a few months prior. Just like life, Medicare always has an exception to the rule, and if you were born on the first of the month, Medicare starts you the first of the previous month. So let's say you were born May 1st, Medicare would start your Medicare actually April 1st. You would have seen that card come a few months prior. So nice and easy. If you're collecting Social Security, everything comes automatically. But if you're not collecting Social Security and you want your Medicare to begin, nothing happens automatically. You do need to initiate that process. And again, that would be about 2 to 3 months prior to your 65th birthday if you want your Medicare to begin the first day of the month of your 65th birthday. You also have the month of and 3 months after to sign up. But if you do it during that time frame, there'll be a delay. It's not ever going to backdate to the first of the month. And then the last group of people would be, I'm going to work past age 65. Do I have to take Medicare? The answer generally is determined by the size of your employer. So if you or your spouse are actively working and have your insurance through an employer with 20 or more employees, you can delay signing up for Medicare Part A and Part B without penalty. So an example might be you're working at a hospital, well over 20 employees. You have your insurance through that hospital. You don't have to do anything. You can just stay on that employer plan, because if it's 20 or more employees, you're treated the same as everybody else. Your employer plan is primary. But if you're working at a company with less than 20 employees, you're generally going to need to take Medicare A and B at that time. So just kind of going back to the employer plan, though, with more than 20, many people will say, well, I heard I have to sign up for A at least. You don't have to. Many people do. Part A is premium free. So you sign up. If you ever end up in the hospital, there may be some coordination of benefits. The only people that, signing up for Part A would hurt them is if you had a high deductible plan and you paired it with what they call an HSA, a health savings account, where you're taking pre-tax dollars out to fund that high deductible plan. You would not want to sign up for Part A at that point if you were still working at a company, because you're not allowed to contribute to an HSA and be on any other plan other than that high deductible plan. So I am going to go through 2 more slides and then we'll stop and take some questions on Medicare. So the next slide is just if you only have Medicare and nothing else, some of those costs. So again, Part A was your hospitalization and your skilled nursing. An example would be, let's say you went into the hospital and you only had Medicare. You would be covered your first 60 days in that hospital after you paid an initial deductible of $1,600. So it wouldn't matter if you're there 1 day or 60 days. When you left that hospital, you would have a bill for $1,600. If you were there for more than 60 days, at day 61, you would start to pay $400 a day. And at day 91, you'd start to pay $800 a day. Also, the skilled nursing facility is under Medicare Part A. You do need to be admitted in the hospital at least 3 days prior for that benefit. But then Medicare covers you the first 20 days at 100%. And day 21 through day 100, you would pay $200 a day. So the Part A of Medicare, it works off of what we call a benefit period. A benefit period starts the day that you enter that facility and ends when you've been out for 60 consecutive days. So an example might be, let's say you go into the hospital on the 1st of the month, you left on the 10th of the month, you go home for a few days and you go back in. You're not going to pay that $1,600 again. You're simply going to pick up where you left off, day 11, day 12, day 13. But any time that you go home for longer than those 60 consecutive days, when you go back into the hospital, that will be a new admission. So they come day 1, day 2, and that's how you would pay that $1,600 again. So the Part B, a lot easier to understand. Part B is all of your doctor care and outpatient services. It has a calendar year deductible each year, and in 2023, that deductible is $226. So you'd be responsible for the first $226 of your medical care each year. Once you've hit that deductible, you never pay it again. And then Medicare is that 80-20 plan that we talked about. Medicare A and B does not include prescription drug cover or outpatient prescription drugs. So we'll talk about that later in the presentation. Medicare covers you anywhere in the U.S. and our territories, but not worldwide. It doesn't add in routine vision, hearing, or dental care. So that is a very quick rundown of Medicare, that big Medicare and You handbooklet. It should come every year to you sometime by the end of September, October. It'll have all the information here. But any questions on Medicare? Yes?
So when you first talked about the enrollment thing, and there was the cost you said
$164.90, yeah.
So it says for most people, Part A is
Mhm.
What is most people have to put that in?
Sure. So for most people, if you or your spouse paid into the Medicare system through your taxes, typically 10 years, or they could say 40 quarters, Part A is free, or premium free once you go on to Medicare. For Part B, most people will pay the $164.90, but if you're in a higher income bracket, you would pay more. So I have a reference slide in the back. I'll just go to it now. So for most people, if your income's under $97,000 as an individual or $194,000 as a married couple, you're going to pay that $164.90. But as your income goes up, the Part B goes up. And when we talk about Part D, that also goes up. Now, what they're going to do is they're going to look at your last tax return. That's how that's determined. So if you do have to pay more, it's not always for life. They're always changing it every January 1st. For some people, you might say, well, I just retired, and they're looking back, 2 years almost, my income's different. You can always appeal it. That's a life event. Any type of life event you can appeal. But if you do nothing, every January, they're re-looking at your last tax return and adjusting that Medicare premium. So good question.
So it's only one thing with that.
It's almost like it's hard to say if they're looking back, but your last when you file your tax, it's from the year prior. So it's almost a 2-year look back there.
Does that, if you once you hit 65, does that amount get reduced if the company will have to pay the company?
So if you have a retiree health plan, when you retire, does the amount you pay the company, is it reduced? Every company would have a different factor on what they pay, their percentage that they're paying for their active employees versus their retiree employees. Typically, though, the answer would be yes, it would be a lower amount because there's, Medicare involved with paying some of the cost of the health plan that you're going to be on. Yeah. You're welcome.
So as you're approaching 65,
Mm-hmm.
it's on us to contact Social Security. Nothing comes from them saying you're approaching 65.
Correct. So his question is, do you have to outreach to Medicare to enroll? And the only people that don't have to would be people that are collecting Social Security because their card's going to come automatically. But if you're not collecting Social Security, yes, the onus is on you to reach out if you want to enroll at that time. So you don't have to talk to them if you are not taking it, but it's always a good idea to check in. But if you say, well, I'm going to wait because I'm actively working and I have my insurance, you can simply contact Social Security when you're stopping work and lose that insurance. They're going to say, well, where were you at age 65? Why didn't you take it? You're going to say, I was actively working, or my spouse was actively working with health insurance on an active employment status. They'll give you a form for your employer to fill out to verify that that's true, so there's not any penalties involved. So just to be clear, like actively working is not COBRA. If you turn 65 and you don't sign up for Medicare, you're not actively working company insurance, there's penalties for it, and you can find yourself in a tough situation on getting onto Medicare and having insurance. But if you're actively working, insure more than 20 employees, it doesn't hurt to reach out to Social Security, Medicare if you want to have that touch base point, but there's no need to do it if you don't want to. There's no benefit. I mean, you can sign up if you're going to reach out. Some people reach out and they sign up for Medicare Part A because Part A is free if you don't have the high deductible HSA plan. And then if you ever end up in the hospital, there could be some coordination of benefits between your employer plan and Part A. There could not be. It's a coordination of benefits, but that could be a benefit there. Any other questions? No, great. Yep. The 226, good question. So how does that happen for the Medicare deductible? So an example might be you join Medicare and then you go to see a doctor and the first doctor that you see charges $500. So eventually what's going to happen is you're going to get a bill from the doctor for $226 because Medicare didn't pay it. So they're going to bill Medicare and then Medicare is not going to pay it. And you'll get that bill for the $226 from the doctor, not from Medicare. All right, so now what we're going to do is we're moving on from Medicare, and now we're talking about what if I want more coverage than Medicare? What are the types of options that I can choose? And the first type of pathway we're talking about are called Medicare Supplement and Medigap plans. So if you've done any reading, you've seen those two terms, and they're interchanged all the time. It can cause a lot of confusion, but they mean exactly the same thing. They're a type of private insurance plan that you're buying from Blue Cross or somebody else that fills in the gaps where Medicare left off or supplements where Medicare left off. So Medicare is your primary insurance. Medicare is always paying first. And then you bought a private insurance to simply pick up that leftover amount. So the private plan is waiting for Medicare to pay. Once Medicare pays and there's a leftover amount, that's what the supplement plans are picking up. So they're always picking up the 20%, but they might pick up different deductibles depending on the product that you buy. So in Massachusetts, we have 3 Medicare supplement plans. They're regulated by the Division of Insurance. No matter which company that you pick, there's a standard outline of coverage for those plans. In the rest of the country, they go off of a different structure of A through N type of plans, but they all work the same way. Medicare is primary, health plan is secondary. Any doctor, any hospital that takes Medicare, no referral. So you want to see a doctor in Connecticut, California, Massachusetts, makes no difference. You want to see a dermatologist, cardiologist, you have the freedom to do that. So any type of Medicare supplement plan that you buy, you're not calling Blue Cross, you're not calling those companies to say, what's your provider directory booklet? All you need to know is if the doctor takes Medicare, they take these plans, because the plans are really just a payer, waiting for Medicare to pay. The plans bring in enough money every month from their membership to simply pick up where Medicare left off. That's why you don't see a lot of extras in these plans. You're not seeing the money towards glasses, dental cleanings. You're buying a separate prescription drug plan because, again, it's the Medicare benefits. Medicare's primary. Health plan is simply picking up where Medicare left off. In Massachusetts, the 3 plan designs, these are regulated by the Division of Insurance, are called Supplement Core, Supplement 1A, and Supplement 1. The Supplement Core plan, I'm just going to give you an average of the premiums because every company will have a little bit of a different premium because they're going to have a different membership. But the Supplement Core plan would start around $130 per person per month. The Supplement 1 plan would start, 1A would start around $180, $190 per person per month. And the Supplement 1 plan would start around $230 per person per month. I'm going to talk about the Supplement 1 plan first because it's the easiest one to understand. So anytime you see these check marks, it means it picks up the Medicare leftover amounts at 100%. So on a Supplement 1 plan, anytime you go to the doctor, lab, hospital, x-ray, surgery, whatever you're doing, Medicare pays first, the supplement pays second. There's no cost for you. There's no co-payments. There's no deductibles. You're going to pay $230-something a month times 12. That's your cost of your Medicare covered services that year. Because Medicare pays first, the health plan pays second. So very predictable cost. That plan, these plans in Massachusetts, you need to be a Massachusetts resident, and you need to have Medicare A and B to join. The Supplement 1 plan, though, you do need to be eligible for Medicare prior to 1/1/2020. So if you say, well, I'm just turning 65 next month, next year, you're not going to be able to choose that plan. You would choose between the core or the Supplement 1A. And there's no worry because the Supplement 1A is exactly the same plan, minus you're going to pay the Medicare Part B deductible. So this plan runs around $190 a month. The first time you receive medical care that year, if it's more than $226, you're going to pay that $226 deductible, the Part B deductible. But after that, every time you go to the doctor, lab, x-ray, hospitalization, everything's covered at 100%. So again, very predictable cost, 190 something times 12 plus 226. That would be the full cost of your Medicare covered services, whether you had $1 million worth of services or none, predictable cost. The Supplement Core plan, for outpatient care and doctor care, it's the same as the 1A. You're going to pay your first $226, but after that, every time you go to the doctor, lab, x-ray, covered at 100%. Because it's a lower premium, let's say starting around $130 per person per month, if you end up in the hospital, you are going to pay the hospital deductible of $1,600, and you do pay skilled nursing at day 21. If you move your eyes to the bottom of the page, you can see that none of these plans include prescription drug coverage. So back to that model at the beginning, it's you need Medicare, then a supplement. These plans, you would need to buy a separate Part D plan. Medicare only covers you in the U.S. and our territories. The 1A and the 1, they are regulated to cover you worldwide. Works a little bit different outside the U.S. You typically need to pay upfront, come back, and submit your claims, where in the U.S. there's no claim forms that you need to worry about. The core plan does not have a check mark. We do cover you worldwide at the core at Blue Cross's plan, and many of the other carriers do as well. But I just wanted to not have one there so you know what the minimum standard is. You'll never have less than what's on the screen, no matter where you go. So those are the ones in Massachusetts. If you say, well, I'm moving, I'm going to be in South Carolina or Florida, California when I retire. Well, on the Medigap plans or the Medicare supplement plans, if you take those plans, you need to be a Massachusetts resident. You can move and keep them. But if you're turning 65 in a different state or you're eligible for Medicare in a different state, then in another state, you'll have the options of A through N. And it's going to be the same concept. Medicare is first, health plan second. You're going to look at the monthly premium and see what deductibles that they pick up. Not every state will have all of those letters. They may have a mixture. In other states, they work a little bit differently than Massachusetts. So in Massachusetts, we have no pre-existing conditions or health screenings. The premium is, everybody pays the same regardless of their age. In other states, it may be different. So you want to, just depending on the state that you were residing in, to look at that. So any questions on the Medigap plans? So if, like on a supplement plan, if you went more than the 100, if you were just on Medicare alone and you went past that 150 days, you would have no additional coverage. So you would want to buy a supplement plan. Somebody in the hospital is going to let you know when you're there at day 150 to take a plan. And if you're on our plan or any of the supplement plans, they add an additional 365 days onto that. So now I always say, if you're there at 450 days, somebody's going to be talking to you at that point. The skilled nursing. So skilled nursing is really for rehabilitation care. So when you think about skilled nursing, you want to think about, I went in the hospital, maybe I had pneumonia, I had a hip surgery, I'm not ready to go home yet, I'm going to go into a skilled nursing facility. It's to get you back up on your feet. An average skilled nursing facility stay is about 13 days. So even though you have the 100 days of skilled nursing, you're not guaranteed 100 days anyway, because it's more for rehabilitation care. So if somebody had, let's say, Alzheimer's, dementia, that's not the benefit for the skilled nursing. Medicare nor a health plan is going to cover that. So you just would want to be aware of that. That's more long-term care. And if there's something more major, let's say somebody had a accident, and they didn't go to the hospital, they might have gone directly to Spalding Rehabilitation. That's a different benefit as well. It's not skilled nursing, it's rehabilitation, hospitalization type care. So yes, you could go over the 100 days. If you did, there would be no coverage on this, but generally people don't. So, any other questions? Mm-hmm. Yeah, so third or second, however you want to look at it. So where we are right now is you would have Medicare A and B, $164.90. If you wanted more coverage and you're buying it through a private insurance company, you'd buy a supplement plan ranging from $130 to $230, depending on the product that you wanted to buy. They don't include prescription drug coverage, so then you would need to look for a separate prescription drug plan. The supplement and Medigap are exactly the same. Yeah, sorry. Yeah, same thing. Terms are interchangeable. Yes, yeah, sorry. So Medigap, Medicare supplement, same thing. Yep. So some people like that pathway, and they might say, well, I don't need prescription drug coverage, so I won't take it. You don't have to take prescription drug coverage, but if you don't take it and you don't have what the government calls creditable coverage, prescription drug coverage as good or better than a Part D plan, then later on, if you want to get onto one, you would get a late enrollment penalty. So most people going down that pathway of just Medicare supplement, you're going to need to buy a separate prescription drug plan. Those drug plans can range anywhere from in the single digits to over $100-something a month. Average Part D plan is about $35 per person per month, but it really will vary based on what your needs are. You don't want to have to call every company out there to check your medications, the premium, the copays. So at the end of this presentation, we'll have a reference slide with Medicare, Shine, Mass Medline. These are all resources that you can call or meet with. You give them your medications. They'll put it in the computer system. They'll tell you the best Part D plan to buy based on your medications. Because at the end of the day, it doesn't matter if you're paying, $30 a month or $50 a month for your Part D. What you want to know is that your medications are covered and you're paying the least amount of money out of pocket and premium and copays to take home those medications. And if you don't take any medications, lots of people just look at the lowest plan, take that plan or whatever plan they're comfortable with. And you can always change your plan once a year. We'll have a slide on that as well. But regardless of which Part D company you pick or plan that you pick, They all follow, again, a standard outline of coverage that's set by the Center for Medicare and Medicaid Services. And many times people will say, well, when I sign up for A or B, I'll just sign up for Part D. There's no such thing as just Part D. Part D is always through a private insurance company, and what you're paying for that Part D is what that private insurance company is charging. All of the Part D plans are going to have these 3 levels of coverage called the initial coverage, coverage gap, and catastrophic. What will be different from plan to plan or company to company will be the formulary, the list of drugs the plan covers, the co-payments that you pay in the initial coverage, and some of the pharmacy networks. And those are all the things that help determine those monthly premiums. So this is the way the Part D plans will work no matter which company that you pick. Some plans will have a deductible and some plans will not. Some plans might have a deductible only on certain tiers of medication, but Medicare sets it at a limit. So no deductible would ever be more than $505 in 2020. That would be the highest deductible that you would see. And again, some plans won't have deductibles. And then every plan out there will have what we call the initial coverage. This is where you're giving allotment of money towards the total cost of your medication. So when you choose a Part D plan, whether you're spending $10 a month or $50 a month on one, this initial coverage is never going to change. It's an allotment of $4,660 towards the total cost of your medication. Now, total cost is what the pharmacist is charging for you to take home your medication. So very different than what you experience while you're still working, or even if you have a retiree plan, they usually don't follow this model. So while you're working, you might pay just $10 to pick up your medication, and you never cared if that medication's actual cost is $50 or $500. You only worried about your copayment. But when you're on a Part D plan, they're going to subtract your copayment and what the health plan paid on your behalf. So let's say you go into a pharmacy and you're on a Part D plan, and the medication that you're picking up only has a $10 copayment. So you pay the $10 copayment, but the pharmacist was charging $100 for that medication. So yes, you paid $10, the Part D plan paid $90, but the full amount will be subtracted from the $4,660. Now you have $4,560 left to spend. So they're always debiting down the total cost of the medication. If you don't use it up, it simply resets every January 1st. You get the new Medicare allotment. Some people will use it up. Maybe they have $5,000, $6,000 worth of medication. If they do, they enter what we call the coverage gap, where you start to pay 25% of the cost of your medications. So the pharmacist would know at that point, now you're paying 25%. You would continue to pay 25% until the end of the calendar year, when it resets and gives you the new allotment of money, or you would continue until you hit the catastrophic coverage. So the catastrophic coverage is for people that have very expensive medication. Let's say somebody said, I have $10,000, $20,000, $30,000 worth of medication. You would be worried about paying that 25% that year. So the catastrophic coverage is saying, if in a given year, by paying a deductible, any co-payments in the initial coverage, what you're paying that 25%, if you ever hit $7,400, then for the rest of the year, that plan will kick back in and cover you at 95%, and you would pay 5%. So this is how every Part D plan will work if you're buying it on your own. I just want to kind of go back here again and show you where we are. So Medicare $164.90 for most people. Medicare supplements $130 to $230. Part D, everybody will have a different experience for the premium, but let's just say around $30-something. If you have group retiree coverage, usually the Part D is unlimited. You don't have to worry about that coverage gap. So sometimes when you are retiring from a company and they say, well, we have retiree coverage, and you say, well, why does my friend pay less than I pay? It might be because you have a very comprehensive prescription drug coverage that you wouldn't be able to buy on your own. So that is one pathway. And lots of times when we go through this, people will say, hey, I didn't expect that. I didn't know Medicare even had a premium. And now you're talking about a couple $100s for a health plan and drug coverage. And if you're feeling that way, I'd say hold off, because we're going to talk about the Medicare Advantage plans next. Very different way of doing things, typically much lower premium, medical prescriptions all in one. But for others, sometimes people are here and they say, well, I was continuing to work. I was worried about leaving my employer plan. I really need good medical coverage. I'm dealing with chemotherapy, radiation, MRIs. And then you can see there's a lot of peace of mind to know that you could pay, $190, $200 something a month, go to any doctor, any hospital that takes Medicare, and really essentially have all your services covered. So most people, when they choose a Medicare plan, they're very happy with it because there are plans that are going to meet everybody's needs. Sometimes you're lucky enough that, both options are going to meet your needs. But again, there's a weight and balance. So now we're going to talk about the Medicare Advantage plan, unless anybody has any questions on the prescription drug coverage. No? Okay. So very different way of doing things. You never do both. This is a different way. Again, these are the ones you're seeing on TV all the time, celebrity endorsements. And, when I'm out in the community, I'm always asked, how is this possible? So obviously nobody's offering a plan at zero cost without some funding. So what happens is when you join a Medicare HMO or PPO plan, Medicare is going to send the health plan a set amount of money every month for every member that comes on that plan. So we're going to get money from Medicare. If you're on the plan and there's a premium, you're sending the premium. So we take that Medicare money, your monthly premium, we pool it all together. Then we contract with doctors and hospitals. We give you all of your Medicare covered benefits, plus additional benefits that Medicare doesn't cover. Probably money towards glasses, dental benefits, the drug coverage is embedded. In exchange for that, now when you go to those doctors or those hospitals, you just show your one healthcare card. You no longer show your Medicare card. Because if you showed your Medicare card and they billed Medicare, Medicare would say, hey, we already prepaid that plan to manage your care. So you show your one healthcare card, they bill the health plan, we pay the claims out of that pool of funds, and you're always paying a copayment or cost along the way. You also always need to have your Medicare. You're no longer showing it, but you're still paying that Medicare premium. The co-payments that you pay are going to depend on the plan that you choose. So it's not going to follow those Medicare benefits. You're always going to have Medicare benefits, but what you pay are going to be the summary of benefits that that plan put in place. So in Massachusetts, we generally have HMOs and PPOs. An HMO is a health maintenance organization. You're picking a primary care doctor, and that doctor is going to refer you on for your specialty care. A PPO is a preferred provider organization. You can pick a primary care type doctor, physician of choice, same thing. That's usually a family doctor, internist, nurse practitioner. But with a PPO, you never have to go to that doctor if you don't want to, because you don't need referrals on a PPO. You can stay in network to the contracted doctors or go out of network to any Medicare provider. So a little bit more freedom with the PPO. Just at Blue Cross, we have 4 Medicare HMO plans and 3 Medicare PPO plans. So we have a portfolio of 7 Medicare Advantage plans. A lot of the other carriers, they're going to have that same type of portfolio. So there's a lot of products out there for you to choose from. Just to give you an example, let's say I'm going to look at a 0 PPO plan. And then you look at that 0 PPO, it's got your medical, prescriptions, money towards dental cleanings, probably fillings. It has a lot of extras. And you say, well, what am I going to pay when I go to the doctor? Maybe one is $45. And you say, well, I went to my specialist 10 times last year, 10 times 45, $450 I'm going to pay if nothing changes. Works out great. So that person would have a great experience on that PPO. If all of a sudden their health changed and they go in the hospital, labs, x-rays, they're going to pay some keep paying co-payments. All of these plans will have an out-of-pocket max. That's the most you could pay in a given year towards your Medicare covered services. So many people never reach those out-of-pocket max, but it is a possibility. So that's what you would look at is, am I comfortable with that out-of-pocket max on that plan? Because that's your risk factor. What's nice though is you're not making a decision for life. When you choose these plans, when you first go on to Medicare, you can choose any of these options. That's your initial eligibility. But every year you can relook at them October 15th through December 7th and change for a January 1st effective date. So all of our circumstances can change, but so can your health plan every year. There's another time frame if you're on a Medicare Advantage plan every January 1st through March 31st. So a few days from now, if you were on a Medicare Advantage plan, you have one time during that period to kind of relook at your plan again. Maybe you missed looking at it during that change period. So one period of time where you could go back to Medicare, go to a supplement, change to another Medicare Advantage plan. But after March 31st, you're sort of locked in to those Medicare Advantage plans for the year until that October 15th through December 7th. Special circumstances, moving out of the area, residing in a long-term care setting. Any questions on the Medicare supplement versus Medicare Advantage? No. We talked about this slide, the Part B and the Part D. So you also get a surcharge for Part D for the higher income bracket. And here are some helpful resources. Here's the Medicare number, the Social Security number, Shine, Serving Health Information Needs of Everyone. You don't have to call that 800 number. You can come right here to the Medfield Council on Aging, ask to talk to a Shine counselor. They'll know all this information. They'll know all the plans in your area, and they'll offer one-on-one counseling for you. If you don't want to meet in person and you're just looking to find help with a prescription drug plan, you can call this number, Mass Medline. They're a great resource. You give them your medications over the phone. They'll tell you the best Part D plan to buy based on your medications. We have a wonderful program in the state of Massachusetts called Prescription Advantage. It's a free program. It is based on income, but it's a very generous income bracket. There's no acid test. If you qualify for Prescription Advantage, it helps reduce your prescription costs. And here's the Blue Cross number in our Blue Cross website. We have a host of information on our website, a whole bunch of educational videos, materials. We have our product information. We have pre-recorded webinars. We hold webinars every day. We're out in the community doing product presentations. So again, there's no limit to be able to find that information. But hopefully for today, I know it's a lot of information. We never expect anybody to leave here to know exactly what product that you're going to buy. But hopefully what it answered for you is that, okay, I know when and how to enroll into Medicare. I know the types of plans. Do I like a supplement? Picking up where Medicare left off, no co-payments, but I know I need to buy a separate prescription drug plan. So when you're looking at those plans, you understand that. Or do I like the Medicare Advantage, all-in-one medical prescriptions, but I'm going to pay some co-payments along the way. I'm going to look at the doctor network and those out-of-pocket maxes. Any last questions on Medicare? All right, so this next section only takes a couple minutes to go through. This is, well, what if I need coverage before Medicare eligibility? It's really going to depend on what you're looking for, what you have access to, and the cost. We have them in order of what typically works best for most people: spouse or partner plan, COBRA, then direct pay. So a spouse or partner plan would be you're actively working, you leave your employer, you have the insurance, but your spouse is still working. Well, that would be a qualifying event for you to go onto your spouse's plan. Usually the best bet, because if an employer is offering coverage, they're paying at least 50% of that premium. But not everyone's going to have that option. So then you would look to COBRA, which is temporary continuation of your group plan. COBRA is very easy to understand because it's the exact same plan that you had while you were working, but the employer is no longer chipping in. So you're going to pay 100% or 102% of that premium. Employees are generally eligible for up to 18 months. Spouse or dependent children could be anywhere from 18 to 36 months. So I always say take your COBRA rate and you can compare it to what we call the direct pay market. That means you're calling Blue Cross, you're calling another carrier. You can buy individual, family, couple, but they're going to take the oldest person in the group in your zip code, and that's how you're going to have a list of products to choose from. Just to give you a general idea, if you were looking for individual coverage at age 63, we are probably looking at around $800 something a month for that plan, 800 plus or more comprehensive plan. So usually COBRA is going to be better, not always the case. Also, because everybody needs to have health insurance in Massachusetts, they also have the Massachusetts Health Connector. And there, if you qualify, and again, it's not low income, they're not looking at your assets, but it is income qualifying, you can buy a subsidized plan through them. So that's always the best bet if you qualify. And that's it. So I just want to thank everybody so much for coming tonight and your questions. And I'm going to be around after if you have any more. So thank you.